So with HPV, we talk about cancer first and the fact that the vaccine can prevent a major trigger for cancer. When I'm faced with a discussion regarding HPV vaccination with my parents, I typically will try to sandwich the discussion of the HPV vaccine in between the Tdap and the meningococcal vaccine. I find that parents are very comfortable talking about tetanus boosters, and I can talk about the meningococcal vaccine as a college vaccine and mention to the parents that their child's not ready for college yet, but we're getting them ready for college, and that there'll be a booster involved as they get closer to college, and that the HPV vaccine prevents an adult cancer, and they're not adults yet either, but we're getting them ready to become adults. So we try to sandwich the HPV discussion so that it feels comfortable that this is a routine. I also don't pose it as a question. We don't ask the parents if they want HPV vaccination, just like we don't ask them if they want a tetanus booster. We tell them this is the routine vaccine that your child is due for. Most parents in my practice are fairly comfortable with the vaccines that I'm recommending. And the most common question I'll get back from my patients is, Dr. Lehman, did you give your kids this vaccine? And I can confidently say, yes. I brought them back from college, we vaccinated them, and I'm very comfortable with the vaccine. So they're often looking for, in a sense, a physician champion who feels very confident about the vaccine. There are parents in our practice who will not respond to a calm discussion based upon science when it comes to vaccinations. And although those parents are few and far between, there are times where I must respect that parent's choice to make decisions for their child. I try to encourage the parent to read about the vaccine. Our lead nurse will give the parent information about the vaccine. And you can bet that the following year, I'm going to discuss that vaccine again, and the following year, I'm going to discuss it. And I promise the parents that for the child's sake, I'm going to discuss that vaccine each year that they come back, expecting that they will become comfortable with the vaccine. Our staff was fully trained with HPV vaccination. I had the entire staff attend a Delaware American Academy of Pediatrics sponsored HPV educational session so that everybody knew about the vaccine from the time a patient checked in until they were leaving. All staff were on board with HPV and comfortable with the vaccine. We really didn't have to change anything that we were doing. I looked at this vaccine as a routine vaccine. We were already giving routine vaccines, and our job was to figure out how to order the vaccine, how to bill for the vaccine, but it really didn't change our workflows that significantly, given the fact that the HPV vaccine is coupled with other vaccinations. When it comes to scheduling the HPV vaccinations, we couple the HPV vaccine with their next appropriate visit, typically a well visit. Once the well visit is established, then we have reminders that go out either in text, email, or through the Mind and More's portal. If a patient no-shows for a visit, then we have one person assigned in the office to track down the no-shows within the week, contact the patient, and reschedule the vaccine and the well visit. And those same reminders, text, emails, and Mind and More's portal will also go out to those patients.